is speaking and not muted, please try to mute yourself for non-speakers, of course, or non-speakers at the moment. So, Professor Taguchi, the floor is yours.
Okay, thank you very much for nice introduction. So now I sent you a link from which you can download this slide. So if you are interested in, you can download this slide from this link. Okay, today I would like to talk about these topics, the big data situation in Japan and other Asian countries. But basically, I'm studying bioinformatics, so I'm not a very expert of this field, so please do not expect too much in my talk. My name is Taguchi, came from the Department of Physics, Chuo University, Tokyo, Japan. And the first country I would like to introduce in Asian area is China. China has strong need for air-based medical care because in the urban area in China, so the life is very similar to ours. So I'm in a developed country, but in still there are many rural areas. In this situation, the situation is definitely developing countries. The population ratio between urban area and rural area in China is 7:3. This is the statistics last year. And the rural areas, they cannot have well-equipped medical systems. So access to the people there is very poor. Now, so there are strong demand to institute remote medical care in this region because if they can implement the remote medical system in these regions, they can provide medical care for the poor people with very limited cost. And on this is a reason why the China government need to accelerate the air-based medical system. On the other hand, they have a strong advantage to develop this kind of system. So as you know, so China is not a really democratic country, so they don't have to take care of the human rights so much. So it is not difficult for them to collect the huge personal information. And this is benefit for them to develop the machine learning based system because they can make use of the huge data sets they have collected. This is a photo of the so-called software infrared CT-RAN developed by the Chinese company InfraVision. This software has been introduced to even the developed country, including Japan, and because in a developed country, it's easy to get enough personal information to develop this kind of machine learning system with large data. So people and the developed country can easily import this kind of software developed in China and make use of it. And in addition to this, people in the rural area have strong motivation to provide personal information because in exchange of the providing personal information to government, they can have medical support from government. And in addition to this, in China, medical doctors' payment is so low, so Chinese government can provide enough amount of money for developing system and air-based medical care. So all of these advantages and needs drastically accelerate air-based medical care in China. And in addition to these advantages and needs, recent COVID-19 pandemic further accelerated air-based medical care in China. This photo is a so-called health code in Shanghai. And this indicates the danger of SARS-CoV-2 infection. This mark can be displayed mobile, and without the green sign, people cannot use the public transport system. So the people are strongly motivated to provide their personal information because otherwise they cannot get this green signal and they cannot use public health. systems. And so because of that, recent COVID-19 pandemic drastically accelerate AI-based medical care in China. And the second country I would like to introduce here is Korea. Korea is, generally speaking, one of the most digitalized country in the world. This tab is taken from the IMD World Digital Competitive Ranking. Korea is here. This is 8th most digitally equipped country. And so as you can see, Norway and Finland, this is a European country, the North European country is still lower ranked than Korea. So by this ranking, you can understand how well the Korea is digitally equipped country. Of course, States is the topmost country, but Korea is one of the most digitalized country in the world. And in addition to these digitalized system in Korea, they have additional advantage. So medical care system has already been unified into one. As I will discuss later, in Japan, the medical care system is not unified, so it is easy to collect the information. But in Korea, they have already established a unique medical care system. Then it is very easy to provide their health personal information. And they have already developed a national health insurance data sharing service system. And they are now started to the future disease probability. And the goal of this kind of system is the so-called precise medicine. And as in China, also in Korea, recent COVID-19 pandemic accelerates AI-based medical care. For example, as outbreak of COVID-19 in Wuhan, second last November, Korean company ECG developed a PCR-based test kit for infection only in 3 weeks. Even without getting the real samples, only getting the information, digital information from that China government has provided. And surprisingly, this test kit developed only by digital information has been approved by FDA later. So this means they have a good skill to make use of this kind of information. And Corona 100M is some kind of SARS-CoV-2 infection trace tool, was released as early as February 2020. It is very early stage. And also the corona map, this big database trace tool can visualize moving paths of infected people. And finally, I would like to discuss the system in Japan. So I'm Japanese, but actually speaking, medical DX in Japan is very bad. There are some reasons why we cannot develop the very equipped data systems in medicine. One reason is one positive reason. Japanese people here is so hard workers. Without introducing this kind of AI and DX system, a system can work to some extent. And negative reason is people are so conservative, so they dislike to install the very new system, because if they replace old system with the new system might not work well. So then they hesitate to introduce new system. And the present stage in Japan is very low. So we can make use of the receipt data. Receipt data means how much amount of money you pay for which disease. So presently, we can make use only this data. The reason of this is strong diffuser. The people dislike to be recorded in data information for their health system, because disease information is sometimes wrongly used and they will be fired. And in addition to this, our healthcare system is not unified. So every information is distributed in the individual hospitals and in the completely different format. It is difficult to correct the integrated manner. And this kind of lack of digital medical system damaged our counter plan to COVID-19. So we have not yet have effective SARS-CoV infection tracking system, and the government provided some tablet by which we can submit the vaccine information, vaccination information, but it didn't work well. And in order to suppress the SARS-CoV-2 infection, we need to close some shop. But the Japanese government failed to support these closed shop economically because information is exchanged by this kind of old system, the facsimile. So we are very behind in this field. So unfortunately, I don't have so many information other countries than these three countries, but I will briefly discuss about some other countries. For the India is one of the biggest Asian country, and situation in India is very similar to China. First, rural area has similar need in China. They are poor and they do not have enough medical systems, and remote system are strongly encouraged to develop for these areas. And India also has huge populations. This means they have also opportunity to get large information to develop the machine learning system. So they have great advantage. At the moment, medical DX in India is development stage, but next year, the market size of this medical DX in India predicted to be this amount of money, so huge potentiality of this kind of system in India. On the other hand, Singapore is a small country, but their government system is well digitized. For example, they have already established some system by which they can collect the health information stored in the hospital into one. And also they have tried to introduce a robotic system to healthcare. And Singapore has already had a portal where the people in Singapore can retrieve their information stored in system by logging in this system. So you can see that this thing pass. Oops. Okay, this is some ID by which they can retrieve their information. So Singapore is well digitalized systems. In conclusion, and this area, East Asian area, hotspot of medical DX. This is a number of patents related to medical DX in these days. So of course, the States is the topmost country to release this kind of patents related to medical DX. But China is quickly approaching this United States, and Korea is following this trend. Japan is far behind this country, but still third, or in Asia, third most country to release patents related to medical DX. So, conclusion. At least in East Asian area, including Japan, Korea, China, a hotspot big database healthcare system, because people here is more group oriented. So comparing with European country states, they don't mind to be collected their personal information. And historically, the people like to collect everything and keep it for future use. So we can find many forms recorded in 2,000 years ago. And also the people here is relatively strong to math and language, I mean little language and manual computation. So this means this area has strong potential to be equipped by the digital or AI-based medical systems. Thank you very much for interest. So I will answer the question in chat.
Thank you. Yeah, thank you very much. it's yeah, kind of surprising that I see, for example, this old fax that I was using
Yeah.
many years ago. I almost recognize him, but yeah, I remember when I was in Japan a few years ago. Yeah, people still using paper when we don't use paper anymore in Belgium in most cases. And
Yeah.
it's just it's strange. The image of Japan is sometimes different from the reality, like in many countries.
Yeah.
I don't see any
Can I ask?
question at the moment, so it means that
Yes. Did you-
what you are saying was clear. But somebody,
Did you-
Ilya is asking a question. Yes.
Yes, easy to ask. Thank you very much. Fascinating presentation. I wanted to ask you, I'm very old, I'm almost 50, so I remember what happened in the 80s and early 90s. And back then, Japan was at the forefront of the world in digitalization. We just worship Japan and everything happened there. And you say now it is falling behind. What happened? Something went wrong. How do you estimate this?
Yeah. As I've told you, the people here is so conservative. So perhaps COVID-19 pandemic can change the situation, but at the moment we have no idea. So.
But what happened compared to from the 80s? I mean, it's the same people, and now is the situation changed for politics, economics? Why?
Yeah. Actually speaking, we are not very adapted to recent progress politically and international situation. So perhaps Japanese people cannot change their behavior so well. So perhaps they are not so. Actually speaking, Japan is very isolated from other countries. They didn't recognize the situation has drastic changes since the 80s. Sorry for I cannot.
Okay, thank you.
Okay. I would like to answer this. I disagree 100% with both presentation about the confidence in government and the concentration of health information. I would prefer more decentralized. Okay. Yeah, I think so too. But in Korea and China, the people are not so terrible, not so negative to collecting by information by government. So it will differ from other Asian states. So their behavior, they are not so mind about the privacy compared with other Asian country states.
Yeah,
this is very different.
Yeah. I will also answer, well, it's a long discussion, but I will also answer to Mauricio in one sentence that you can have kind of decentralized systems, but who are still, let's say, managed, I don't know the word, by public institutions or also by NGOs. But now it's time for a small pause. The great thing is we are more or less respecting the